This technique, we're going to work through this posterolateral portion of the neck, through the upper trap region. I'm going to use the flat of my fist for this one, and we're going to have an active component of flexion and or rotation and side bending. So we can use a combination of movements here, similar to what we did with some of these other seated neck techniques. So what I'm going to do is I'm going to start with some flat fist pressure to the back of the neck. Just for the sake of the video, I'll demonstrate this one first, and I'll show you on the other side what we're doing. So we can do bilateral, or we can work through one side at a time. Totally depends on symptoms and what we're trying to achieve. So I'm going to start with flat fist on the back of the neck. I'm going to apply some downward pressure, so I'm getting some drag on the skin. So lack of oil in this one is a good thing because we want some grabbing on that skin. So I'm going to apply some downward pressure, and as I've got that downward pressure, I'm going to get Eduardo first to slowly take that chin towards the chest. So as he drops down into cervical flexion, I'm applying that downward pressure and maintaining that so we get some drag. He can stay in that position, and I can slowly drag out across the shoulders, or we can add in an active flexion and extension throughout that movement. So if we start again from this position here, our downward pressure, and then we're going to go chin towards chest, and then coming back to neutral, and once again chin towards chest. So each time he moves into flexion, I get a little bit more drag down those tissues at the back of the neck. Now obviously having a table nice and low so you can get more body weight over the top is ideal for this, or I can sit up on that table with my knees and apply that downward pressure. So at the moment I'm working down posteriorly along those paraspinal tissues and that upper trapezius, working down the spine. So we could, if we wanted to, work our way all the way down to the lumbar region, back and forth through neck, flexion, back to neutral. And then we could start to include thoracic and lumbar movement as we get lower. Other movement we can introduce into this flat fist technique to our upper trap region is adding in some side bending or rotation. So I'm going to apply some downward pressure again, slightly more lateral to what I did last time. And as I maintain that pressure, we're going to get Eduardo to move slowly back and forth from one side to the other. So introducing some side bending initially. So we can go bilaterally as we do this, or just the one side. And again, each time he moves, I get slightly more drag through that tissue. And then from this neutral position, this time we're going to add rotation. So we'll look over the left shoulder, and then we're going to go back toward the right. Once again, maintaining that pressure, and each time he moves, we get slightly more drag through those tissues. So be aware of your shoulder position. Again, if you can, have the table nice and low so you don't feel like you're elevating your shoulders. Just due to the table I've got here, I can't get it as low as I normally would, but if I wanted to, I can bring myself up higher onto that table and apply more downward pressure.